So today we will be studying about pancreatic function test. So as you know, pancreas is a unique organ of the body which has two parts. It is an unique organ because it has two parts. It has two types of tissues. One is endocrine and one is exocrine. Endocrine means the tissue which acts by hormones, or which is mainly which functions regarding hormones only. And exocrine function of the pancreas is related to digestion. So endocrine pancreas is involved in energy metabolism, deficiency of which results in diabetes mellitus. So you know that there is a disease called diabetes mellitus, which is due to the defective production of insulin in the body, or if the cells of the body become less responsive to insulin. So basically it is a problem of insulin. So which gland produces insulin? It is pancreas. So if there is any problem in the endocrine function of the pancreas, then the person may get affected by diabetes. So this is regarding the endocrine function of the pancreas. Then what is the exocrine function? Exocrine pancreas plays a major role in digestion and absorption of all essential nutrients from the GI tract. GI tract क्या होता है? हाँ. So why do you do this pancreatic function tests? It is for the assessment of exocrine pancreatic function, diagnosis of pancreatic insufficiency, and differentiation of pancreatic and non-pancreatic causes of malabsorption. First one is assessment of exocrine pancreatic function. So obviously if there is a problem in the exocrine pancreatic function, we can know it by seeing the problem in digestion. So we can relate it to that. And another is pancreatic insufficiency. So if the pancreatic juices which are released from the pancreas, they are released in small amount, a small quantity, then obviously digestion will be affected. So it helps in diagnosis of pancreatic insufficiency. Then we can also differentiate if there is problem of digestion due to the GI tract, or either it is due to the pancreas. We can also differentiate all these things. So exocrine pancreatic function tests are based on the assessment of pancreatic secretion in response to hormonal stimulation, or a meal or measurement of production of digestion in the stool that assesses digestion and absorption of nutrients. So what is this? Then exocrine pancreatic functions are based on pancreatic secretion, which is either due to response to hormonal stimulation, means there are many hormones in our body, so they are responsible for release of pancreatic juices, or whatever, they are responsible for many things. Among them, one is the digestion by the pancreas. So whenever the pancreas is working, these hormones will stimulate the pancreas. So we will see whether the hormonal response, what is the hormonal response of the pancreas, whether the response is adequate or it is low or less. Suppose if hormone is produced adequately in the body, but the pancreas is not responding as much, that means the pancreas is having some problems. In a hormone stimulation or a meal, उसमें क्या होता है? In a meal, whenever you are taking a meal, then the pancreas is stimulated and it releases the juices for digestion. And production of that will be products of digestion in the stool. Means there are some, after you take a meal, everything is not digested. Some things will be there which are left over in the stool, which will be present in the stool or the feces. So in some cases, whenever there is any problem with the pancreas, then if the undigested food is in more quantity than what normally occurs in the body, then we can know that there is any problem in the digestion. So that's why there is the pancreas may be involved in that. And absorption of nutrients. And that is also important because the pancreatic juices help in absorption of the food particles or the nutrients which are gained from the food. Apart from color, odor, pH, volume, specific gravity, and bicarbonate concentration of pancreatic secretion, the important parameters analyzed are serum and fecal enzymes such as trypsin, amylase, lipase, etc. So all these things we will see first. One is color. We will see the color of the pancreatic secretion. Then odor, smell. Then this is the pH, 7.8 to 8.3. What is this pH? Basic or acidic? What is the pancreatic pH? ACD. It is basic. Volume. This is the maximum volume of pancreatic secretion. 3 liters. More than that is not normal. Then specific gravity. This is the specific gravity of the pancreatic secretion. And bicarbonate concentration. There is bicarbonate concentration in the pancreatic secretion in a specific amount. So you also calculate that. So all these things are analyzed, and other things which are analyzed apart from this are the serum and fecal enzymes. Means how much pancreatic enzyme is present in the serum. Serum means in the blood. In fecal enzymes means what is present in the feces or the stools. Some examples of these enzymes are trypsin, amylase, lipase, and there are many other enzymes. Then classification. What are the different types of tests we do? One is invasive tests. These are 2 types of tests. What do you mean by invasive? क्या होता है invasive? What is invasive? Whenever we are injecting any foreign particle inside the body, foreign particle that might be in an injection, that might be in a probe, we are doing something which is going inside the body, something extra which is not natural, that is going inside the body. That is called invasive tests. So these are 2 types. First type uses stimulation of pancreatic secretion by meals such as Lundh meal or duodenal infusion of amino acids. So there is a specific type of meal which consists many types of things like corn, then there is some milk protein, and many things are there. There is a specific type of meal. We give this meal to the patient, or we can give duodenal infusion of amino acids. We can give some amino acids into the duodenum, inside the duodenum. So this is one type by which after giving all these things, after injecting all these things into the body, we can see the pancreatic secretion or the pancreatic response to these foods or all these things. Then this is the first type. Then second type makes use of hormonal injection intravenously, such as secretin, cholecystokinin, etc. So I've told you now we can assess the pancreas in different ways. One is hormonal, one is by food. So first one is by food, second one is by hormonal stimulation. We will inject hormones inside the body, and we will see that how the pancreas is responding in response to this food or these hormones. So you can you don't need to remember all these things. That's what is the dosage. Just for your knowledge, you just see it once. Secretin stimulation test. Secretin is injected IV at a dose of 1 unit per kg, and then the duodenal samples are collected for 80 minutes. It increases rate of formation and flow and aqueous component of pancreatic juice. So whenever we are giving a dose of 1 unit per kg of secretin, then the pancreatic flow is increased, and we will be seeing that. We will be assessing the duodenal samples. Duodenal samples we will be taking by a probe. We will insert a probe inside the duodenum, and then we will take it out. So obviously it is an invasive because we are putting it inside the body. So we will suction it out, and that we will study it for the duodenal response. For the pancreatic response. Pancreas से कितना निकल रहा है उसके according. जो आपने secretin डाला है इसके बाद से कितना निकल रहा है. बहुत कम निकल रहा है means pancreas is not functioning that well. और अगर normal रहेगा तो normal है. So another is cholecystokinin. This is also a hormone by which we can test whether the enzymatic component of pancreatic secretion is good or not. Means whenever we inject cholecystokinin into the body, then there is increase in the in the enzymatic component of the pancreatic secretion. तो pancreatic secretion में क्या होता है? Enzymes भी रहते हैं, बहुत सारी चीज़ें रहती है because this is a fluid. तो उसमें ऐसा तो नहीं है कि सिर्फ enzyme ही रहते हैं. तो obviously there are different type of particles in this secretion. तो उसमें क्या होता है? Enzymatic part जो है वो increase कर जाएगा after injecting cholecystokinin. Then meal stimulation test. This consists of milk protein, corn oil and dextrose. ये एक mixture होता है, मैंने पहले ही बोला है. The one is milk protein, one is corn oil, and one is dextrose. What is dextrose? What is dextrose? Sugar. Dextrose is a form of sugar. So we mix it together. the sample is mixed together, all these things are mixed together, and these are fed to the patient. These are given to the patient as food. After that, we measure the response of the pancreas. Content is aspirated for analysis. We aspirate the duodenal colon directly by putting a probe or an injection like that. We suction it out and then we study it. Then we come to the non-invasive tests. These are simpler and cheaper, hence preferred over invasive tests. These are simpler because we are not inserting anything inside the body. So these are simpler and they are cheaper because whenever we are inserting any probe, so that same probe cannot be used again and again in another person. So obviously this has to be bought and these are very expensive things. So that's why these are preferred. However, they are not as sensitive and specific as the invasive tests. Because in the non-invasive tests, many other things can alter your results because there are many other hormones inside the body, many other chemicals inside the body which can replicate all these effects. So that's why these non-invasive tests are not as accurate as the invasive tests, because in the invasive test we can go directly into the duodenum and we can directly pull out the secretion of the pancreas. Visualization of pancreas and scanning by ultrasonography, CT scan, MRI, cholangiopancreatography, etc. are usually performed before opting for biochemical pancreatic function tests. So all these things are generally done before the biochemical tests because we do not directly go inside the pancreas of any patient. We first of all, whenever any patient comes to you, like with complaint of pain abdomen or anything such that, we cannot directly infer that it is due to pancreas. So you have to first see the outline of the stomach, the other organs of the abdomen, and then whenever we are visualizing that there is some problem with the pancreas, then only we can go for further tests inside the pancreas. So all these things are first done priorly. CT scan, ultrasonography, MRI, all these things are non-invasive. So what are the three types of non-invasive tests? First type includes estimations in stool for food particles that are not absorbed, like fecal estimation of fat and fecal enzymes. Means there is a specific quantity of fat which is not absorbed in the body. So normally it is around 5 gram per day. 5 gram per day of fat is thrown out into the stool by our body. But if it is more than that, then we can know that this fat is not absorbed because there might be some problem in the pancreas. So by this we can diagnose the problem of the pancreas. And we also see for fecal enzymes like trypsin, chymotrypsin and elastase, because the pancreas releases all these enzymes into the duodenum. So obviously some of these enzymes will come into the stomach. But if this enzyme count or the enzyme quantity is very low, means not as much as the normal count, so obviously that means that less enzymes are produced, that means the pancreas is not functioning as much. Second type includes estimations in blood, urine and breath for products of digested food due to action of pancreatic enzymes that are absorbed into the systemic circulation. So after the all the food particles or the nutrients of the food particles are absorbed by the help of the pancreatic juice. After that, we will look for how much of the nutrients are actually absorbed into the blood and urine. So obviously urine and stool are both different things. Stool is something which comprises of some undigested particles, but urine is something which is filtered by the body from the blood. So obviously if something is present in the urine, that means that already it was present in our blood some time ago. So we will check the blood and the urine and breath. So all these things are inside the systemic circulation. So all these things we will check for and we will check for products of digested food. मतलब कोई food अगर digest हो गया है, उसका बाकी nutrient क्या है अंदर, कौन सा nutrient अंदर गया है नहीं गया है, तो वो देख के हम लोग बता सकते हैं. So due to an action of pancreatic enzymes that are absorbed into the systemic circulation. Third type includes estimations in plasma or blood for hormones, Schilling Test, and enzymes, amino acids, etc. So third type includes plasma or blood. We will check the plasma or the blood for hormones and enzymes, amino acids. मतलब ये जो रहता है बाकी pancreatic hormone or pancreatic enzyme and then the amino acids, we can count it in the blood. First is fecal estimation of fat. Normally about 5 gram of fat is excreted per day in the feces. In pancreatic deficiency, excretion of more than 20 gram of fat is common. If there is very severe deficiency, then it may be even 50 gram or more. in the stool. Fecal estimation of nitrogen. About 7 grams of nitrogen is excreted in stool per day in a healthy individual. In pancreatic deficiency, due to decreased proteolytic enzyme activity, nitrogen excretion increases in stool. So what happens? Due to decreased proteolytic enzyme activity, proteolytic means protein and lysins means breakdown. So what happens? The pancreatic secretions break down the enzymes, break down the proteins. But if there is insufficiency in the production of these enzymes by the pancreas, so obviously that much protein will not be lysed, or those much protein will not be used up by the pancreas or destroyed by the pancreas, broken down by the pancreas. So this nitrogen excretion will be more inside the stool, means these are not absorbed. Then D-Xylose Absorption Test. What is this? D-Xylose. What is xylose? Do you know the types of sugar? What are the types of sugar? These are there in your class 12, I think. Name of the sugars. Okay, D-Xylose is a pentose sugar which is administered at a quantity of around 25 gram, and its recovery in urine is measured over next 5 hours and in blood in next 2 hours. It also helps evaluate response to therapy. So we will be giving a pentose sugar around 25 grams inside the body of the person, of the patient. Then we will assess in the urine and the blood. Means if you are assessing in the urine, in the blood, and if the sugar is present, that means digestion has occurred and the sugar is already absorbed inside the body. That means by this we can see whether the pancreas is functioning or not. It also helps evaluate response to therapy. Means if someone's pancreas is diseased and we are giving him any therapy, any medication. So after that medication also, if we give this sugar and if the quantity of increased absorbed sugar is increased inside the blood and the urine, that means we can know that the therapy is working, the pancreas is getting better. Schilling test. It is done to assess the absorption of vitamin B12, which requires intrinsic factor. So I might have told you in a class now that due to deficiency of increasing factor, vitamin B12 is not absorbed inside the body, which can lead to anemia. So what happens? Vitamin B12 deficiency is seen in chronic pancreatitis because trypsin helps in binding B12 to intrinsic factor, after which the complex is reabsorbed. So what is trypsin? Trypsin is a pancreatic enzyme. So this helps bind the vitamin B12 to the intrinsic factor. There is intrinsic factor, there is vitamin B12. In between there will be trypsin and they will bind it together. So if there is no trypsin available, even if there is adequate amount of intrinsic factor, then the body will be deficient in vitamin B12. That's why in chronic pancreatitis, anemia can occur. Then serum amylase estimation. So what is amylase? Amylase is a digestive enzyme synthesized in the pancreas and in the salivary glands. So there are two types of amylase. One is salivary amylase, one is pancreatic amylase. Most of the amylase present in circulation is of pancreatic origin. So obviously pancreas is bigger, so it produces more amylase than the salivary one. In acute pancreatitis, amylase leaks into circulation from the damaged cells. Therefore, serum amylase is greatly increased in acute pancreatitis. So normally what happens, this amylase is stored inside the pancreas. Like you can consider it as vacuoles or as bags. So whenever this pancreas is not, there is an inflammation inside the pancreas. So these cells can rupture, or these cells can leak this amylase into the bloodstream, inside the bloodstream. So the amount of this serum amylase will be greatly increased in chronic pancreatitis. In acute pancreatitis. So what happens, by this we can get an idea that the person is suffering from pancreatitis by the blood counts only. Normal level of serum amylase is around 60 to 120 units per liter. In some books it is written as 60 to 180. So in acute pancreatitis, serum amylase concentration becomes very high, up to 500 units per liter. Sometimes it can exceed 500 also. There are sometimes 1100 to 1200 like this. So there may be very high amylase concentration in the blood. So this differentiates pancreatitis from other conditions of acute abdomen. So what do you mean by acute abdomen? Acute abdomen means it is short form for acute pain of abdomen. If there is an acute pain, sudden pain in the abdomen, that is called acute abdomen. So if you are, if a patient comes to you with a sudden pain in abdomen, and you are doing this amylase test, and you are finding it to be around 500, 600 like this, so you can get in your head an idea that this might be due to pancreatitis. So you can get a clear idea by this blood test only. That's why it helps differentiate from other causes of pain abdomen. Then serum lipase. Lipase is another digestive enzyme synthesized in the pancreas. It also leaks into circulation from damaged pancreatic cells in acute pancreatitis. Hence, serum lipase is increased in acute pancreatitis. It is the same condition, same story as the amylase lipase. And amylase and lipase are very important for seeing the overall health of the pancreas in case of any pancreatitis or any pain abdomen case. So these tests are very important. Then cholangiopancreatography. This is an invasive test. This is a special radiodiagnostic investigation in which the details of the contour of the hepatopancreatic duct system. You are getting it, na? Details of the contour means what are the structures, we can see it, of the hepatopancreatic duct system are visualized by introducing an endoscope. A thin endoscope will be inserted into the mouth of the patient. From this, the endoscope will directly go inside the pancreas, and it can see the lumens of the pancreas, whether the lumens are intact or not, or what has happened in them, is there any inflammation or not. So this procedure is called endoscopic retrograde. Endoscopic retrograde cholangiopancreatography. This is the most accurate test for assessment of pancreatic structure and function. So this is the most accurate test because we are directly going inside the pancreas, inside the tubings of the pancreas, or inside the ducts of the pancreas. So you can directly see the structure of the pancreas. So what other tests you can do? Ultrasonography. Pancreas is visualized by scanning. So we can scan the whole of the abdomen, and we can see whether there is any structural abnormality within the pancreas or not, whether the pancreas has grown in size, whether there is any atrophy or not. We can see all these things by ultrasonography. Then CT scan and MRI. These are also used for visualizing the normal morphology of the pancreas. Then cholecystography. This one is non-invasive. Using a radio-opaque dye, biliary duct system and gallbladder filling and emptying can be assessed. So we will use a dye. Dye means, what is dye? Yeah, we will give a liquid which is colored, a different color. Sometimes it may not be a color. It might be radioactive, or it might be visible only by any special method. So we can see if we do that kind of CT scan or like any MRI or like this, so we can visualize the dye. So we will be visualizing the dye, and if suppose the dye is not going in any part of the pancreatic duct, so you can know that there is some stricture or there is some problem within the pancreatic ducts.
So there is non-invasive can dye the body.
If the patient will eat it, drink it. Patient will drink it. After that, we will just take a photograph, means CT scan or something else. So by this, we can know that whether it is entering the pancreas or not.